Great, Mark. Thanks a lot for doing this. And you got a project you're announcing today. You teamed up with Carnegie Mellon to track COVID-19 across America and around the world. Just explain to everybody how it works and what you hope to achieve.
Sure. Thanks for having me, George. So what we're doing is we're partnering with researchers at Carnegie Mellon University to run a widespread survey across Facebook asking people what kind of symptoms they're feeling, whether that's a fever or a cough, shortness of breath, loss of smell, or nothing. And then those responses go to the researchers at Carnegie Mellon. So we don't actually see them at Facebook, the individual responses. But then we're able to work with the researchers to produce an interactive map based on the aggregate data that provides a daily updated county by county map of the symptoms that people are experiencing across the country. And you can imagine why that's a valuable tool to local governments and public health officials in figuring out what the response should be, where to direct resources like PPE and ventilators, and then eventually to figure out things like where they can safely start to reopen places, or where they might need to clamp down on the restrictions again if things start to resurge.
Well, anyone who checked in on this could literally see hotspots develop or hotspots recede.
Yeah. So one of the ideas here is that people experience the initial symptoms days or weeks before they would think to go to the hospital or before they develop the most severe illness. So by doing a survey like this, it's trying to help set up an early warning system that can give local governments and public health officials a little bit of a sense of what might be coming. It also allows potentially a more apples to apples comparison because testing is inconsistent across the country. So that way people can have a sense of, okay, in this county, here's a sense of what people are feeling compared to in this other county. So that way governments can help allocate the scarce resources that they have towards the response.
So everything would be based on obviously self-reporting. How can you guarantee, or how can you increase the chance that it's going to be accurate?
Yeah, that's a great question. So that's a lot of the work that the health researchers at Carnegie Mellon have been doing to make sure that the data that's coming from the survey is high quality and that it correlates with what hospitals are seeing on the ground. And the initial indication that they have, and we've been running this survey for almost 10 days now to make sure that that we can get good, consistent data. The initial read is that this is high quality data that does correlate with the caseload that people are seeing in hospitals some number of days after people are reporting symptoms. So that's a good sign that this can be used to help with the broader models and forecasts that governments and public health officials are using to guide some of the biggest policy decisions that we need to make.
Are you seeing anything surprising so far?
Well, so we're trying to be careful on the Facebook side that our role is to help get the survey out to people at scale. And we can use our software engineering skills to help build the interactive map. But we're really leaving it to the researchers and public health experts to interpret the data for the most part. That said, I think if you look at the maps, there are some things that I think would jump out to you. Some journalists have reported, for example, that ski resorts might have been playing an early role in the spread of COVID, and whether we do see in the maps that some of the counties around where there are prominent ski resorts have a lifted level of people experiencing symptoms. So there are things like that you can see. But then I also think it'll be interesting to track over week by week and day by day results of where certain places are improving as certain public health policies get put into place, and also, unfortunately, potentially where things are starting to get worse and stricter policies might be necessary.
So this obviously would be first use, as you say, to health professionals, local government officials who can follow the map and see we have a problem. I mean, it's also the kind of thing we can be showing our viewers every day to track how this is spreading or receding across the country.
That's right. That's right. The other thing that we're announcing is that we're going to start running these surveys not just in the U.S. But internationally. So today, the data is available for the interactive maps in the US. You can go to the website, and basically anyone can look at the map, can zoom in on any county and see the prevalence of symptoms there. And we'll update that daily through this crisis. But we're also going to start this week running the survey in all the countries that Facebook operates in around the world. So that's pretty much every country except for a couple like China and North Korea. So this will hopefully give an apples to apples sense of comparing across countries on a county by county basis in every country. Where there are more needs everywhere around the world.
That can be such an amazing tool, but I can also imagine a lot of leaders in a lot of countries who aren't going to be happy with that kind of transparency.
Yeah, George, that's right. I mean, we're certainly seeing that there are some governments that I think might be trying to suppress how bad the disease is in their countries. And some folks certainly have tried to push back on us providing that level of transparency. But ultimately, I think that this is important not just to give governments and public health officials data to help make decisions, but I do think it can also help, especially in countries around the world, to help keep them accountable and honest about what the symptoms are that people are feeling in their countries and in their counties across the world. And hopefully that can play a role in helping with the response as well.
I think one of the biggest concerns people watching at home might have is as they think about giving over, it's about the most private information you have, your health information, logging into Facebook, answering this survey, how can you guarantee that's going to be protected?
Yeah, I think that's a good question. And so here's what we're doing. The individual data and responses actually don't go to Facebook at all. We never see them. They go to researchers at Carnegie Mellon, and then Carnegie Mellon produces an aggregate report that doesn't include anyone's individual response, but just on a county basis or on a hospital referral region basis. They then publish that data, which we then use to create these interactive maps. And we also want to make sure that the data can be useful for other academic research. So Carnegie Mellon's sharing that aggregated data with other academics and health officials and folks like that as well. But it's a really important part of this program that Facebook is helping to distribute the survey, but it's Carnegie Mellon's survey, and Facebook actually does not see the individual data from anyone's responses. So I think that's a really important point to make sure that people understand.
During this pandemic, there's an awful lot of fear out there, as you know, and awful lot of bad information. And I know that Facebook, at least in the last couple of weeks, has tried to figure out ways to prevent the spread of bad information across your platforms. Describe how that's working right now.
Yeah, that's right. So we're primarily doing two things. One is focused on trying to spread authoritative health information, so good information. And then the other, trying to make sure that we limit the spread of misinformation. And on the positive side, we've built this COVID information center, which is, it's full of information from sources like the CDC, local governments, authoritative health information. And we've put this at the top of everyone's news feeds. So more than 2 billion people have seen the link to this. And more than 350 million people have clicked through and consumed a bunch of content based on that. So I think that's really good news in terms of helping to get authoritative, trusted information out there. On the side of making sure that we also limit the spread of misinformation, there are a couple of different areas that we're working on. One is there's harmful misinformation. So things that could cause a risk of imminent physical harm. So things like someone spreading the idea that if you drink bleach, that can help cure this, which of course it can't. And saying something like that is dangerous. So we take that down, right? That's not allowed on our service at all. And there have been thousands and thousands of pieces of content like that that we've had to take down. There's also just broader misinformation where people say things that are false that may not put people in imminent physical risk or of danger, but we still don't want that to be the kind of stuff that's going viral on our system. So, there we actually just put out a stat that the independent fact checkers we work with have rated 4,000 different articles on our system as false, which has triggered more than 40 million warnings across the system of people viewing content. And we have a sense that those warnings work because 95% of the people who see a piece of content with a warning on it don't end up clicking through and looking at that content. So overall, we're doing a lot on this. And I've been pretty proud of how the teams have done. But as you say, it's a really important problem, and we need to keep on working on it.
So how do you deal with the fact that Facebook is now being used to organize a lot of these protests to defy social distancing and defy the social distancing guidelines in states? Does somebody trying to organize something like that, does that qualify as harmful information because it's saying defy social distancing?
Yeah, so this is an important question. If someone is spreading something which is misinformation, which certainly something saying that social distancing is not effective to help limit the spread of coronavirus, we do classify that as harmful misinformation, and we take that down. At the same time, it's important that people can debate policies, can basically give their opinions on different things. So there's a line on this. But more than normal political discourse, I think a lot of the stuff that people are saying that is false around a health emergency like this can be classified as harmful misinformation that has a risk of leading to imminent physical danger, and we'll take that kind of content down.
President Trump said last week that he was going to be calling you to talk about COVID and the economic response as part of his Economic Revival Commission. Does that happen?
I think he organized this call with the White House and a lot of business leaders across the economy to talk about reopening and some of the steps that they were planning on taking, and I think emphasized a lot of the public talking points of their plan in terms of a staggered rollout over time, trying to help restart the economy, but hopefully being careful about how we do that to make sure that the virus doesn't have a resurgence, which is obviously very important.
And how about on your side? You've been pretty cautious as a company, as leader of Facebook. You were one of the first companies to go to remote work, and you said you're not going to have any gatherings of over 50 people into next year. It sounds like you think that we should have something of a go slow approach.
That's right, and especially for us. So, we're in the fortunate position where, since we do engineering, a lot of that work can be done productively remotely. So because of that, I think it's clear that society is going to need a staggered approach to reopening. So not everyone is going to be able to go back at once. And frankly, I just think that there are other people whose livelihoods depend on them being able to go to work, that we should give those people right of way. So what I've told everyone at Facebook is that they should expect to work from home through at least the end of May, and perhaps likely to be a bit longer. And some of that is just geared at making sure that other people who need to be able to go to work physically in order to do their jobs and make their living, that those people can access those public resources first. I just think that that's important and is the responsible thing for us to do. So even if other people can start going back sooner, I think we will still likely be a little more conservative about as we start to open up our own company.
How has this affected your business? Is advertising down, up, neutral?
I mean, advertising is certainly down. We're kind of seeing multiple effects across what we do. On the one hand, usage of the services has gone up a lot because people rely on the internet and social and communication apps to be able to stay connected with the people they care about, especially in times of disaster, and especially in times where they can't physically be with those people. And right now we have both. So usage of the services is definitely elevated. Things like video calling, group messaging. I mean, that stuff is in many cases up 2x or even more. But regardless of that, advertising typically gets hit more than average in an economic downturn, and we're certainly seeing that impact ourselves.
And how about your life?
We'll be fine. I think our business will be able to weather it, and we're lucky to have a stable business, but. Right now we're mostly focused on making sure that we can help the broader community get through this.
And how about your personal life? What has this meant for you? How has it changed your day, your routines?
Well, like you, I'm sure, I'm working from home, which, it's initially, quite challenging to manage as the kids are home from school. We have 2 young girls, right, 4 and 2 years old, and, they're around all the time now. And, on the one hand, it's great being able to see them throughout the day. On the other hand, sometimes I need to go do an interview like the one that we're doing now, and I try to prevent them from running in. Although the audience might like it if they did, I probably would.
Right now, I get it.
Yeah, so I think that this is what everyone around the country is trying to manage, is just being it's being stuck at home for a long period of time. It's trying to look at the bright side of being able to spend more time with my family and the people I love the most. But at the same time, I mean, look, it's I think that this is a challenge that everyone is adapting to.
Everyone healthy?
Yeah, we're lucky on our side. Our family is healthy, and our friends, and that's been great. And I hope you're feeling well and doing well as well at this point.
Everyone here is on the mend. It's great, and thank you for spending time today. And we look forward to following this project as it goes forward.
All right, thank you, George. Talk to you soon.